Hello. If you are a psychologist, counselor, therapist, or social worker, the next 8 minutes could genuinely change how you think about your professional future. I am not going to pitch you. I am going to show you something real, something the Supreme Court of India created on July 25, 2025, that opens a business opportunity your profession has never seen before. Let us go. Quick question, and answer this honestly. What happens to your income the week you fall sick? Or take a holiday? It drops. Or it stops completely. That is the ceiling every solo practitioner lives with. Your income equals your personal hours. You cannot grow beyond yourself. Hiring feels too risky without guaranteed revenue. This is not your failure. It is how solo practice works. But something just changed that gives you the exit from that ceiling. And it came from the highest court in the land. On July 25, 2025, the Supreme Court delivered judgment in Sukhdev Saha v. State of Andhra Pradesh, a case arising from the tragic death of a student in Visakhapatnam. In that judgment, under Article 32 and declared as law under Article 141 binding on every authority in India, the court issued comprehensive guidelines on student mental health, and it applies to every school, college, university, coaching center, and residential academy in India, public and private, no exceptions. Now look at this slide carefully because this is where your opportunity lives. The court issued 6 guidelines that directly require a qualified mental health professional. Guideline 2. Every institution with 100 or more students must appoint a qualified counselor or psychologist. Guideline 3. Optimal student-to-counselor ratios. Dedicated mentors during exam periods. Guideline 6. Mandatory staff training twice a year, conducted by certified mental health professionals. That is you. Guideline 10. Anonymized records maintained. Annual report submitted to UGC AICTE or CBSE. Guideline 12. Structured career counseling by qualified counselors. And Guideline 8. If institutional neglect contributes to student harm, the institution faces legal liability. 6 separate legally mandated service requirements, all requiring you. Now let the numbers land. 1,113 universities, 43,796 colleges, hundreds of thousands of schools and coaching centers, everyone with 100 or more students legally obligated right now. Number currently compliant? Near zero. Now think about just your city. Dozens, maybe hundreds of institutions, all legally obligated, all needing a qualified professional. The entire market is open. And in most Indian cities, no mental health professional has yet claimed this category. Here is something I want you to sit with honestly. If a college principal called you today and said, "Can you manage mental health compliance for our 5,000 students, generate annual regulatory reports, train our entire staff twice a year, and serve us alongside 10 other colleges simultaneously?" Could you say yes? Not because you lack knowledge, but because you lack infrastructure. Proactive outreach to thousands of students impossible manually. Automated anonymized records. No system to generate them. Population dashboards not without software. Your credential is complete. Your infrastructure alone is not. That is what Briea solves. So what exactly is Briea? Briea is the operating system for student mental health compliance built from the Supreme Court judgment outward. Every feature maps to a specific guideline. 3 layers. Student layer: voice-first AI in Indian languages, WhatsApp access, 5 validated screening tools, proactive outreach 24/7. Escalation layer: 3-level privacy-first system, student identity protected until clinical thresholds are crossed. Governance layer: anonymized records, annual regulatory reports, population dashboards, board-ready and regulator-ready at one click. Briea handles the scale. You handle the clinical judgment. Together, you are the complete answer. Look at what is built into the platform. PHQ-9 for depression, JD-7 for anxiety, PSS-10 for stress, PSQI for sleep quality, WHO-5 for overall well-being. All 5, globally validated, used in clinical and legal settings worldwide, integrated, longitudinal, and automated. No other platform in India combines all 5. You interpret the results. Briea generates, stores, and reports them. Court-defensible evidence produced continuously, not reconstructed after an incident. And what does Briea cover? Everything. On one single platform: mental health, validated assessments, AI weekly follow-ups, qualified counselor referrals, fitness, daily nudges, DIY workouts, consistent habit building, nutrition, disease-specific personalized diet plans, lifestyle management, tobacco, alcohol, sleep, stress, disease management, 1-year proactive care journeys, medication adherence, continuous monitoring, diagnostics, home sample collection across India, AI-interpreted reports in plain language, structured follow-up on every result. This is the slide I want you to really absorb. Today you work, you earn. You stop, it stops. With Briea and institutional contracts, your team delivers counseling and training across multiple institutions. Briea runs the platform 24/7, and revenue arrives monthly whether you are in every session or not. What becomes possible? You employ junior counselors and psychologists funded by institutional contract revenue. You serve 20, 30, 50 institutions. You build a named practice with real enterprise value. You expand to other cities. You stop being a practitioner with a ceiling. You start being the founder of a mental health compliance firm. And look at what one institutional relationship actually generates: annual empanelment, biannual staff training, career counseling delivery, annual compliance report preparation, parent sensitization programs, crisis response retainer, 6 billable service lines from one institution. And none of these expire, because the Supreme Court obligation does not expire. District magistrate monitoring committees are being constituted in every district right now. Compliance pressure increases over time. Your revenue grows with it. This is not session income. This is infrastructure revenue. So how does the partnership actually work? It is one simple model. You become Briea's regional mental health partner in your city. You sign contracts with institutions under your name, your brand, or Briea's brand, whatever gives you the strongest entry. You deliver all the professional services. Briea runs the infrastructure behind you 24/7. And here is what makes this genuinely powerful: Briea is not just a mental health platform. It covers nutrition, fitness, substance control, disease management, and diagnostics too. So you walk into every institution offering complete student health compliance, not just one piece of it. The commercial model could not be simpler. You pay Briea per student fee. Everything above that is yours: your service charges, your training fees, your retainers. The more institutions you serve, the stronger your business becomes. One last thing, and this matters. Right now, the category is unclaimed in most Indian cities. You can walk in today. Within 90 days, the Union of India compliance affidavit is due before the Supreme Court. Government machinery is moving. By the 2025-26 academic year, NAAC and UGC are embedding these guidelines into accreditation frameworks. After any serious incident at any institution, professionals already embedded are trusted partners. Those arriving after are just vendors. Every institution that signs with another professional first is an institution that no longer needs you. The window is open. It will not stay open. So here is where we land. The Supreme Court created the mandate. Your qualification gives you the right to fulfill it. Briea gives you the power to scale it. Call us or write to us. Details are on your screen. The category is there. The question is simply, will you claim it in your city, or will someone else?